Welcome to AVT2032 Principles of Animal Healthcare and Disease. Topic 5.3 General Pathology, Cell and Tissue Growth Disorder. Cell and tissue growth disorders include atrophy, hypertrophy, hyperplasia, metaplasia, and neoplasia. Let's go through every one of them in this lecture video. The learning outcomes for this lecture video as follows. 1. Define the most encountered changes in cell or tissue growth or size: atrophy, hypertrophy, hyperplasia, metaplasia, and neoplasia. 2. Describe causes, development, and effects of cell or tissue growth changes. Cells respond to injurious stimuli through reversible adaptations like hypertrophy, hyperplasia, atrophy, and metaplasia. These adaptations allow cells to either revert to their original state or establish a new normal to survive in altered environments. If adaptation fails, degeneration or necrosis may occur, highlighting the importance of cellular flexibility in maintaining tissue health. Reversible cell adaptations occur when environmental changes prompt cells to adjust, allowing recovery or a return to normal once the stimulus ceases. If adaptation fails, degeneration may ensue. Key reversible adaptations include atrophy, hypertrophy, hyperplasia, and metaplasia, each representing distinct changes in cell or tissue growth or size. Atrophy is the shrinkage of cell size due to loss of cell substance, leading to reduced tissue or organ size. Causes include disuse, loss of innervation, reduced blood supply, inadequate nutrition, loss of endocrine stimulation, and aging. These factors trigger cellular adaptation, potentially affecting organ function and overall health. An atrophic liver can result from a portosystemic shunt, where blood from the portal vein bypasses the liver, depriving it of essential nutrients. This diversion leads to reduced liver size and function. The gallbladder may also be affected, as the liver's ability to process and store bile is compromised, impacting digestion and metabolism. Atrophic left kidney in rats results from reduced blood supply, leading to decreased cell size and function. This atrophy can be caused by chronic ischemia or obstruction. Over time, the kidney's ability to filter waste diminishes, impacting overall health. Understanding these changes is crucial for developing treatments to mitigate kidney function loss. Skeletal muscle atrophy involves the replacement of muscle fibers with adipose tissue. Causes include disuse, denervation, and malnutrition. This process leads to reduced muscle mass and strength, impacting functional capacity. Understanding these changes is crucial for developing interventions to prevent or reverse atrophy, thereby maintaining muscle function and overall health. Hypertrophy involves an increase in cell size, enhancing organ size and function without new cell formation. Physiological causes include increased demand, like in skeletal muscles, or hormonal changes, such as during pregnancy. Pathological causes involve adaptive responses, like thickening of organ walls, or compensatory growth, such as kidney enlargement after removal of the other. Adaptive hypertrophy in the terminal ileum involves thickening of muscle walls, enhancing functional capacity. Compensatory hypertrophy occurs in the kidney when one is removed, leading to enlargement of the remaining kidney to maintain function. These adaptations illustrate how tissues respond to increased demands or loss, ensuring continued organ performance. Hyperplasia is an increase in cell number, often seen in labile cell populations, leading to organ enlargement. Physiological causes include hormonal changes, like in the female breast during puberty, and compensatory mechanisms such as liver regeneration. Pathologically, it results from excessive hormonal or growth factor stimulation, crucial in wound healing. Once stimuli are removed, hyperplasia typically resolves, Lymphoid hyperplasia in the spleen involves an increase in lymphoid follicles due to persistent antigen exposure. This condition is characterized by an immune response leading to the proliferation of lymphocytes. Macroscopically, hyperplasia can be distinguished from hypertrophy by the increase in cell number rather than cell size, which is crucial for accurate diagnosis and treatment planning. Endometrial hyperplasia occurs due to excessive progesterone influence, leading to abnormal cell proliferation in the uterine lining. This condition can progress to endometrial cancer if untreated. The hyperplastic growth results from hormonal imbalances often linked to obesity or polycystic ovary syndrome and can cause symptoms like irregular bleeding. Metaplasia is a reversible adaptation where one adult cell type is replaced by another, more resilient type. This occurs in response to stimuli such as chronic inflammation. For example, transitional epithelium in the urinary bladder may transform into squamous epithelial cells to better withstand bladder stones, illustrating the body's adaptive mechanisms to environmental changes. Chronic inflammation from a Sertoli cell tumor can induce squamous metaplasia in the prostate gland. This process involves the transformation of stratified cuboidal cells into squamous cells, adapting to the persistent inflammatory environment. This cellular adaptation enhances the tissue's resilience but may alter normal gland function. Let's do a checkpoint here. Reversible cell adaptations include atrophy, hypertrophy, hyperplasia, and metaplasia. Atrophy involves a decrease in cell size, often due to reduced use or nutrition. Hypertrophy is an increase in cell size, typically from increased workload. Hyperplasia refers to an increase in cell number, often due to hormonal stimuli. Metaplasia involves a change in cell type, usually as an adaptive response to chronic irritation. Neoplasia is characterized by abnormal tissue growth due to rapid cellular proliferation. This growth persists even after the initial stimuli are removed. It involves genetic mutations that are passed to new cells, leading to clonal expansion. Understanding neoplasia is crucial for comprehending how tumors develop and the implications for cancer progression. Neoplasia represents irreversible cell adaptation, persisting even after the initial stimulus is removed. Genetic mutations in neoplastic cells are inherited by subsequent cells, making cancer clonal. This means all cancerous cells in a tumor originate from a single cell, highlighting the genetic continuity and complexity of tumor development. Neoplastic cells exhibit a lack of structural organization and coordination, growing and dividing uncontrollably. Unlike normal cells, which communicate and cease division when unnecessary, tumor cells may grow ineffectively. Some tumor cells are defective, leading to necrosis. This disorganized growth results in partial or complete loss of function within the affected tissue. Neoplasms exhibit a lack of structural organization and functional coordination with normal tissue. Unlike normal cells, which communicate and grow in a coordinated manner, neoplastic cells grow uncontrollably. This disorganization can lead to ineffective growth, where some tumor cells may become defective and die, contributing to tissue necrosis. Tumor cells secrete chemical messengers that promote angiogenesis, encouraging new blood vessels to grow from nearby venules and capillaries. These vessels in tumors can be irregular, easily compressed, or occluded due to the pressure from rapidly proliferating tumor cells, impacting nutrient supply and waste removal. Let's watch a video about cellular adaptation involves changes like hyperplasia, hypertrophy, atrophy, and metaplasia. With this video, I hope you have a better understanding of today's video lecture.
Cellular adaptation is the ability of cells to respond to various types of stimuli and adverse environmental changes. These adaptations include hyperplasia, hypertrophy, atrophy, and metaplasia. These adaptations can be physiologic or pathologic, depending upon whether the stimulus is normal or abnormal. A cell can adapt to a certain point, but if the stimulus continues beyond that point, failure of the cell and hence the organ can result. If cells cannot adapt to the pathologic stimulus, they can die. So let us discuss the four basic types of cellular adaptation: hyperplasia, hypertrophy, atrophy, and metaplasia. We will also explore the physiologic and pathologic stimuli in each of these cellular adaptations, beginning with hyperplasia. Hyperplasia is an increase in the number of cells. Physiologic hyperplasia occurs due to normal stresses. For example, an increase in the size of breasts during pregnancy, an increase in the thickness of the endometrium during the menstrual cycle, and liver growth after partial resection. Pathologic hyperplasia occurs due to an abnormal stressor. For example, growth of the adrenal glands due to production of adrenocorticotropin hormone by the pituitary adenoma, and proliferation of the endometrium due to prolonged estrogen stimulus. Important point regarding hyperplasia is that only cells that can divide will undergo hyperplasia, and these cells include the epidermis, the intestinal cells, liver cells, bone marrow cells, and fibroblasts. Hyperplasia does not occur in myocytes of the heart and the neurons of the brain because these cells do not undergo cell mitosis or cell division. The second cell adaptation is hypertrophy, which is an increase in the size of the cell. Physiologic hypertrophy occurs due to a normal stressor. For example, enlargement of skeletal muscle with exercise. The myocytes cannot divide, but they can increase in size. Pathologic hypertrophy occurs due to an abnormal stressor. For example, increase in the size of the heart due to aortic stenosis. Aortic stenosis is due to a change in the aortic valve, which obstructs the orifice, resulting in the left ventricle working harder to pump blood into the aorta, and so this undergoes hypertrophy. Morphologically, hyperplasia and hypertrophy can look similar. They both result in actually an increase in organ size. Therefore, they cannot always be distinguished grossly, and microscopic examination is required to distinguish the two. The third type of cellular adaptation is atrophy, which is the decrease in the size of a cell that has at one time been a normal size. Physiologic atrophy occurs due to a normal stressor. For example, the decrease in the size of the uterus after pregnancy. Pathologic atrophy occurs due to an abnormal stressor. In general, atrophy is due to the loss of the stimulus to that organ. Specific types of loss of stimulus include when the cell has loss of blood supply or innervation, loss of endocrine stimulus, disuse, mechanical compression, decreased workload, or aging. Here is an example of atrophy of skeletal muscle because of misuse or aging. The final type of cellular adaptation is metaplasia. And metaplasia is the change of the epithelium at a site or location from one type of epithelium to another type. In metaplasia, the epithelium is normal in appearance, but in an abnormal location. How metaplasia occurs is that the epithelium, the cell that is normally present at the site, cannot handle the new environment, the stimulus, and so it converts to a type of epithelium that can adapt to these changes. Metaplasia is more often than not pathologic. A good example is seen in Barrett's esophagus and metaplasia in the lungs. Barrett's esophagus is due to reflux of gastric contents into the esophagus, which causes the epithelium type to convert from squamous to glandular. Squamous metaplasia in the lungs is due to exposure of respiratory epithelium to toxin and cigarette smoke. Most forms of metaplasia are reversible if the stimulus is removed, whereas a few, such as Barrett's esophagus, tends to be permanent once they are established. Metaplasia can progress to dysplasia. Dysplasia is not a true cellular adaptive response. It is where the cells divide and become abnormal in structure and function. It may progress to become cancerous. So those are the 4 important cellular responses, adaptations. But what happens when the cells cannot adapt to their new environment? When cells cannot adapt to certain stimuli, they become injured, which can lead to cell death if not reversed. Some causes of cell injury include hypoxia, decreased oxygen, ischemia, decreased blood flow to that cell, physical or chemical agents, trauma, infectious agents, aging, and nutritional imbalances. Cellular injury can be divided into 2 types: reversible cellular injury or irreversible cellular injury. Reversible cellular injury, as the name suggests, can be reversed if the stimulus is removed and the cell can return to normal function. Irreversible cellular injury means the cell is damaged and dies in an uncontrolled process termed cellular necrosis. The other form of cellular death is apoptosis, which is programmed cell death. In summary, we discussed the 4 cellular adaptations: hyperplasia, hypertrophy, atrophy, and metaplasia. We also discussed cellular injury, when the cells cannot adapt to their new environment, and the consequences of this, which includes necrosis.
Let's recap what we have learned today. Reversible cell adaptations include atrophy, where cells shrink due to factors like disuse or aging, and hypertrophy, where cells enlarge without increasing in number. Hyperplasia involves an increase in cell numbers, while metaplasia is the replacement of one cell type with another. In contrast, neoplasia is irreversible, characterized by uncontrolled growth, potentially leading to benign or malignant tumors.